I'm Alan Finley. I'm an anesthesiologist in Canada. I work just with children, and I do both anesthesia and pain management, but acute pain management and also chronic or complex pain management in our clinic. I do all types of pain practice. Our research is pretty wide-ranging. I used to do work in pain measurement and treatment techniques. Now my biggest interest is how to develop pediatric pain programs, particularly in countries where resources are very limited, such as in Asia and South America. But in fact, those same problems of funding and resources apply all over the world, in Canada and in Spain as well. Well, there are multiple challenges. We're still trying to understand the basic mechanisms of why some people develop chronic pain and others don't. We're trying to develop good combined treatment approaches. And the other big issue is health services. How do we provide care for the numbers of children and adolescents who have complex pain that really can't be managed by primary care physicians like pediatricians and family doctors? That is the problem, is that we're still trying to find solutions for these problems, these questions. We have treatments that we know work some of the time, and we use those. Ultimately, I'd rather that a patient got better, even if I don't know what's wrong, than if I know what's wrong and the patient doesn't get better. There are a lot of techniques well researched in the psychological literature for helping with acute pain, like needle procedures, blood samples, and IVs, and that sort of thing. And we use local anesthetics, of course, or sedation. But there are techniques that parents and health professionals can learn to understand how to do distraction and how to use most effective non-drug approaches for those short, sharp procedures. Chronic pain is more complex, but again, chronic pain in a child or teenager is not just pain in that child, it's pain in the family. And the whole family has to learn how to manage it. Our program involves teaching children about pain, how it happens and why it happens, but also involves teaching parents to understand, teaching parents how to help, which sometimes means teaching them to ignore it and not to focus on it too much, but ultimately to understand the background and the rationale for an approach to ongoing pain.